All right, Stefan Harmon here, Iron Direct Primary Care. I'm here with a friend, Dr. Christie of Christie Chiropractic here in Melbourne. Christie, thanks for bringing me to your office here.
Thank you for coming. Glad to have you.
It's beautiful here. We're going to talk about specifically how chiropractic can be helpful in pregnancy. So a little bit of a background on that. Not a lot of people even know that you can do chiropractic in pregnancy. Is it safe? Give us a little background on this.
Sure. So chiropractic care is absolutely safe when you're pregnant. Specifically Webster technique through the International Chiropractic Pediatric Association. Dr. Larry Webster founded the technique specifically for breech presentation at that time. It does help align the pelvis. And myself and Dr. Molly, my associate here, we are both Webster certified. So when you are pregnant, we know that there's lots of changes that occur to the body. I have 2 kiddos myself, so I've experienced this a couple times. I will not be experiencing it again, by the way. 2 is but nonetheless, yes, your body is shifting, things are changing, you are growing a tiny human inside your body, which is amazing to think about, that you can make a human inside of you. But with that being said, certain things will shift, and you can have, as chiropractors, a subluxation, and that's a fixated joint or segment stuck in its normal range of motion. When this occurs, not only is it going to cause an imbalance like the pelvis, the actual structure, that bony structure, but muscles start and end at bone, and so it will create an imbalance in the muscles and soft tissue as well. And so that's where chiropractic comes in, and we not only adjust the spine, but specifically with Webster technique, we work on the surrounding soft tissue, ligaments, and muscles as well.
Yeah, I just watched you adjust a pregnant lady here. You were moving her piriformis muscles. And what were you doing there?
So part of the Webster technique is working on the piriformis muscle. So getting a gentle release in the piriformis muscle. We actually work on ligaments, like the sacrospinous ligament, the round ligament of the uterus as well, and psoas, which is your major hip flexor.
Yeah. That was great. And you also mentioned something very interesting, is that in pregnant women, they are a little bit more flexible.
Correct. So your relaxin levels, which is a hormone in the body, starts to increase, right? Because your pelvis needs to expand in order to have a child, have a baby. And so you become very loose. And so as a trained chiropractor in pregnancy, we want to make sure that we are a bit more gentle. We can still do a manual adjustment for those who enjoy manual adjustments like myself. But we're just a bit more mindful. We've been trained to be a little bit more cautious because of this hypermobility. We no longer adjust doing certain movements that we would in a male versus a pregnant female, because they're completely different, especially when that female is pregnant.
Wow, fantastic. Now, there are some complications associated with pregnancy. So women want to avoid cesarean section as best they can. They want to, optimize themselves so that maybe not so much pain in pregnancy. Can chiropractic help with some of these?
Absolutely. So again, when you have that subluxation, that fixation, that pelvis is going to become imbalanced. The muscle tissue is going to become imbalanced as well. Inflammation, meaning cellular inflammation, will increase, and that equals pain. So I'm not talking like an edema or swelling inflammation. And so that cellular process is going to start to occur. When you are being adjusted under chiropractic care when you are pregnant, inflammation will decrease, symmetry will be restored. That allows for not only decreased pain symptoms, we're not going to be pulling on that sciatic nerve, that sciatica will be less. The low back pain will be less because your pelvis will be able to function the way that it's been designed to. Baby position will actually improve as well, because if your pelvis has shifted, and I actually have a mobile pelvis in the other room I should have grabbed, but as your pelvis has shifted, if that pelvis is stuck, that baby will not be able to move as they have been designed to as well. And so when you have dystocia, meaning you're unable to regress in labor, it can be for a number of reasons, but we find that patients under chiropractic care, specifically Webster's technique, have better labor outcomes, shorter duration of birth, less breech presentation, less cesarean rates as well, and overall better experiences pregnant.
Well, that's fantastic, because women are very reasonably concerned about the pain in pregnancy. They're going for a lot of epidurals, and when women get into that hospital, it's kind of like a protocol. You go in, you get the epidural, you're gonna get the C-section. That's kind of like a protocol. If we can maybe prevent some of that from happening, I think that'd be great. Save the patient a lot of money, first of all.
Exactly.
Save them a lot of trauma as well.
Exactly. And I mean, I think you hit the nail on the head when you said protocol.
Protocol.
Right? It is a protocol. It's a vicious cycle or a domino effect, as you want to say. You give a patient Pitocin when they're not quite ready for it, right? You get an epidural so you don't feel it. It creates fetal distress. Fetal heart rate decreases, and then what's next?
Everyone's scared and wants to do a C-section.
C-section, instantly. If we can avoid that, and we know that our body is able and capable of it, that medical intervention is there,
It is overused though.
for if it is needed, but it is absolutely overused, and the cesarean rate in this country, for being as intelligent as we are, and I use that word lightly sometimes, is a little bit astounding.
It is astounding.
It's a little bit appalling as well.
Yes.
Mm-hmm.
All right. Other complications or issues in pregnancy, nausea is pretty common. Can we do anything about that with chiropractic?
So sure, absolutely. So chiropractic, actually stimulates the nervous system. And so when we are adjusting, we can stimulate certain areas of the nervous system. For example, your sympathetic nervous system is stimulated in the middle area region of your spine. Your parasympathetic nervous system, more of the calming relaxation nervous system, which is one of the most important when you are pregnant, is occipital and sacral. And so there are moments and times where we only focus on that area if we need that type of nervous system response.
Very cool. Wow. Hypertension in pregnancy. Can we do something about that with chiropractic?
So there has been research that shows that specifically upper cervical adjustments, C1 and C2, can actually help with blood pressure. It's actually really neat, blood pressure and heart rate.
Wow.
I don't have those studies offhand. You can always PM me or PM Stefan here, and we can maybe get you that research. But
well, I don't know much about chiropractic.
Yes.
The conventional medicine
Yes.
system, we don't know anything about chiropractic. So I'm learning it all from you here.
So he will send it my way, and
Yeah.
I will find that for you because I have it in my paper of saved documents, I'm sure. But yes, actually can decrease blood pressure.
Wow, fantastic. Well, that covers a lot of ground for pregnancy and chiropractic. Anything else you want to add to that?
Well, if you're not seeing a chiropractor, you should definitely see one. I mean, even if you're not pregnant, it just helps with overall health. If you're going to take care of your body, and I think that we all should, we know that health is one of the most important things that we are given, and we need to sustain it. We should be part of your team, pregnant or not. And if you are pregnant and you are seeking to see a chiropractor, do make sure that they are Webster certified. Even if you're not local and you can't see me, or you're local and you just don't want to see me, find someone that is Webster certified. And you can look that on icpa.org. icpa4kids.org would be a great resource for someone to find someone locally by them.
Okay. There's like a Webster Foundation.
So it's the International Chiropractic and Pediatric Association. There's a ton of research as well because we also adjust babies, by the way.
Neonates?
We can help with acid reflux, colic, torticollis. Birth can be traumatic for them as well as they go through that process. And so yes, not my own child, because my children were adjusted hours old by myself. Less than 24 hours old was my youngest patient. Yeah, so it's great to get your nervous system checked at an early age because if it's traumatic for the mom, as we described earlier, just imagine what's happening to the baby.
I think if I remember correctly, my sister, when she was just born, she had some issues with burping. We were in Germany at the time. I think she went to like a German homeopathist. I think they did an adjustment on her and fixed it.
Yes.
I'm not sure what German homeopathists do either.
I'm not sure. I know it varies country to country, but yes, finding someone that has
they did some manipulation or something. Very interesting. You can do that in neonates. Very
different technique. Again, see someone that does specialize as we do here, but very light force, no pops, just more of a pressure, I guess would be best described.
Yeah, it is. All right, cool. And that pretty much covers it.